Today I'm talking to Dr. Andrew Hill. Welcome, Andrew. It's really nice to meet you, and I look forward to seeing where our conversation goes today.
Thank you. Thanks for having me. Nice to be here.
Yeah. So I thought it would be good for us to start by you telling people a little bit about yourself, but mostly how you decided to become a cognitive neuroscientist, and specifically what was attractive to you about neurofeedback.
So cognitive neuroscience, for folks that are wondering, what that mad scientist kind of label is. Cognitive neuroscience is typically look at something in the brain, how it works, by overlapping physiology with performance in some way, assessing both, seeing where there's an overlap, and then learning something about how something works, like attention or sleep or stress or anxiety. And I studied that in grad school, but the reason I went back to grad school to study this aspect of the brain was because I was working in this field of neurofeedback and found that a lot of people were getting a lot of change.
Hmm.
So I started off working in health and human services many, many years ago. And I've worked in every aspect, inpatient crisis work, geriatric, dual diagnosis with substance abuse. I ran group homes for several years in Massachusetts with folks that were multiply disabled,
Wow.
developmental, no language, motor issues, deaf or blind. I mean, just
Mhm.
people at often these sort of edge cases of where human suffering can be across all kinds of stuff. And I got injured working in a psychiatric hospital. I was in charge of doing restraints and heading up the teams that would show up in the sort of unsafe environment and try to get them to become safer. And the hospital system was in the process of sort of collapsing. The payments for inpatient mental health were going away, and this was a long time ago now, in the 90s.
Right.
And I left mental health for a little while because of that. And then when I went back into mental health a few years later, I ended up working in an autism center. I had a lot of experience with autism and ADHD and things. And it was a center that used primarily neurofeedback to train the brain. And I had deep experience with kids with developmental atypicality and all kinds of things. And I was blown away by what I was seeing happen in these clients, in this neurofeedback environment, where folks with severe ADHD were having it regulated in a few months, and folks without language or with dramatic sensory issues were seeing shifts of those resources in a few weeks or months sometimes. And this really flew in the face of what I thought we could do. I mean, I spent so much time working in acute inpatient psych where folks had this revolving door phenomenon of coming
Yeah.
in, becoming stabilized, and not really healing or getting better. For a while, I worked on a latency age, an adolescent unit where we had kids from 4 to 10, and then from 11 to 16, inpatient psychiatric. And those folks, you take them out of the environment that's just regulating them, and usually people rebalance, they become very resilient. But I saw people going back out into their dysregulated environments with, difficult socioeconomic stressors and disadvantages with regards to education and crime and poverty and all kinds of things that really got in the way of mental health management. And then when they were inpatient, it was just taking out some of the harm and then usually managing some suffering briefly before those
Yeah.
people went through a whole nother round and repeated the same phenomena.
Right.
So
Usually it's a symptom reduction, not really long-term growth and change, right?
yeah, and this was at a time when the average inpatient stay, as paid by Medicare, Medicaid, and other, phenomena, the big blues, was 11 days on average when I started working in inpatient psych, and over 2 years, the average length of approval dropped to 2 days.
That's nothing.
It takes 3 weeks for SSRIs to start working when someone's acutely depressed sometimes. And when someone's in
Oh,
crisis, you don't even get the drugs to stabilize in 2 days now.
right.
So
Yeah, it's really criminal, I would say, on some level. But I'm curious about, well, I think it would be useful to talk about what neurofeedback is exactly. Like, how does it work
sure.
and what does that mean?
Yeah, neurofeedback is a process of training the brain, training the central nervous system. It's a form of what's called biofeedback. A lot of folks hear biofeedback and think like relaxation work and hand warming and breath pacing and things. And that's a way of taking control of physiological stuff But when we say neurofeedback, we mean the stuff you're trying to control is inside the bones. It's inside the central nervous system. And one of the biggest differences between peripheral nervous system and central is you can't feel your central nervous system. It has no sensory nerve endings. You can't actually feel your brain, ironically, because it's doing all the feeling. You probably wouldn't want to feel it. It's kind of acidic and hot and moving, actually. So it's probably a mercy. We don't feel our brains the way we can feel our heart and things, because it would be way more painful. But the process of doing neurofeedback broadly is just picking up something inside your brain that's varying, like the amount of a brainwave, the speed of a brainwave, or some blood flow or something, and then reflecting it out in a way that is almost brought up to the level of not awareness necessarily, but the brain noticing, because the brain itself doesn't really, the brain doesn't do very good monitoring of its different parts. Part of the mechanisms of information flow in the brain require that the brain be very modular, and information that's being processed is kept apart from other bits of information. So in like glandular communication, endocrine communication in the body, you release endocrine molecules into circulation, and they act for a long time at a distance, gradually, with very low timing precision. But in the brain, you release neurotransmitters into the synapse and not into circulation. The synapse is actually a closed space between two neurons, let's say. It's sealed off in a little opening area. So you're controlling the concentration of neurotransmitters in the little gradient. So the brain's very bad at knowing what other parts of it's doing. There's no like central management of the brain itself that can kind of go, oh, wait, over there, that's kind of a seizure. I should probably pull back on that.
Right.
There's mechanisms for managing stuff, but no high level. So we take some basic features of associative learning and hijack them a tiny bit, take things that are happening and measure them. So let me give you an example that's sort of germane to neurofeedback. The field was discovered in the 60s the way it's done now because of a brainwave that was sort of trained. It was exercised at UCLA. Dr. Barry Sturman was working with cats and found he could operantly condition this brainwave called SMR, or sensory motor rhythm. And we all make SMR. But you've seen a cat on a windowsill holding still and watching birds, you've seen the sort of pure case of it where you get a lot of motoric or body inhibition and a stillness of your focus, which is literally the opposite of ADHD, literally, which is a low SMR state relative to theta, or a lubrication or a release state the brain can produce in its modules. So if you stick a wire on a circuit involved with not being impulsive, or with sustaining your attention when you're bored, that's the right hand central cortex, or the left hand, you can measure moment to moment the amount of these beta waves, measure moment to moment the amount of things like thetas and alphas, which can get in the way of control. And whenever your brain happens to move briefly in the right direction, the computer sees that and applauds your brain with a little bit of gameplay. So the game starts to move, Pac-Man eats dots, or puzzle pieces fill in. And the next moment your brain moves in the wrong direction, and the game slows down or stops. The brain says, hey, where's my input? Where's that stuff? I like stuff. Oh, and then it happens to move in the right direction, and the game resumes its little applause. Good job, brain. Good job, brain. Nope. Good job, good job, good job. Nope. Again and again. And the big trick here, the operant conditioning piece of it, is we adjust the goalposts. Every few seconds, we move the threshold, the criteria next to where you already are. So your brain gets applause for movement it makes in a certain direction from its own brain waves. It's not an active process. It's usually fairly passive in most neurofeedback. And the brain goes, well, that's interesting. Bringing my theta down and SMR up does stuff. Cool. But the mind actually takes a few sessions of training to feel it. Within about 10 minutes, the brain's actually picked up the information loop and is starting to sort of echo and mirror what the outside world is telling it. It's really kind of interesting.
That's
Most
incredible.
people don't feel it.
Yeah, that we are so adaptive, and that mechanism is so sensitive to shift and change. Is there an effect of the act of being able to watch one's brain like that?
There can be, especially for some of the physiological parameters that you have control over, like blood flow. You actually have a tiny bit of voluntary control. If you think happy thoughts or concentrate, you get a massive surge of blood about 2 seconds later. You can wear an infrared sensor on your forehead. I have one here. I do. You can throw an infrared camera on your forehead.
Of course you do. Yeah.
And of course I do, right? and measure waves of heat coming off your brain in real time as like a vascular tone, and
Mhm.
concentrate or think happy thoughts and see it surge.
But
And
does the act of seeing that surge therefore then impact the physiology?
not directly, I mean, a little bit, but no, mostly it's involuntary training. Most
I see.
neurofeedback is passive involuntary. I mean, the cats, that Sturman condition, cats are really bad instruction followers.
They are. Yes,
And
I
this works if
am.
you're unconscious. It works if you're in a coma. Dr. Margaret Ayers, who died a few years ago, was
Uh-huh.
really well known for training people who were in comas and training people who are unconscious quite a lot
Oh,
and
that's
getting changes in
amazing.
brain.
Mhm.
So,
So then the feedback loop of watching one's processes is not really impacting the process.
um, no, well, it is because I say the other way around, actually. The process is adjusting itself to react to what the brain is doing. So
Oh,
yes, but the loops run the other direction, actually.
yeah.
What does affect you dramatically is not the training often. I mean, yes, the training impacts you quite a lot. For some numbers, if you train those circuits on the left and right I mentioned, we typically get about 2 standard deviations of change in ADHD features in about 3 months, which takes severe ADHD and just takes it to the other side of the bell curve often.
That's remarkable.
It's a big change, and it's very
Yeah,
robust, and it's very replicable, and you see it, you feel it. So it's not this mysterious process ultimately.
yeah.
Yeah.
Well, I know there are different types of neurofeedback systems,
Yeah,
and I wonder about that. Like, for example, brain paint was sort of all the rage around the mid
sure.
2015-ish. So just for people that are listening to this and getting excited about it, how would they go about choosing the right form of neurofeedback?
Yeah, it's a good question. Brain paint, I have a lot of respect for Bill Scott at UCLA, who helped develop it. Brain paint is a semi one size fits system where you answer questionnaires about it and it sort of picks from a set of protocols. And initially, at least, brain paint was picked up a lot by inpatient addiction centers
Mhm.
because you could do good neurofeedback. It's very impactful for cravings, for alcohol withdrawal, for
Mhm.
seizure. So you could do fairly good neurofeedback for that population.
Mhm.
Executive function, sleep, stress, anxiety, all this that gets in the way and creates dysregulated relationships with substances. You could do stuff for people very effectively with a sort of menu-driven approach, and that's what Brain Paint has done. But it's not especially well tailored to your like actual physiology. You don't do an assessment of your brain. And I would say
Mhm.
half the field, 2/3 of the field, still works in this area called quantitative EEG or QEEG.
Mhm.
And that is where, and this is actually, I think, what changes you when you engage the process the most is if I show you your brain and then tell you a bunch of things about yourself that are already true and you know them, but now you see them. If I show you the anterior cingulate kind of lit up in high gear, and I say, when this happens, sometimes people get obsessive or a bit, stuck in their head,
Right.
perseverate. Oh my gosh, wow, I have OCD. Oh, okay. There's your superpower, getting stuck.
Mhm.
Oh, your back midline's kind of stuck. Are you kind of threat sensitive and oh, you are, you do ruminate. Oh, some trauma history. Oh, I'm sorry, I experienced that. God, we're seeing it,
Yeah.
because now you have this opportunity to stretch it. You can stick a wire on the back midline, measure the posterior cingulate's like tendency to go, watch the road, and
Yeah.
measure that as beta waves moment to moment, and measure the alpha tone, the softening of that circuit where it can put
Mhm.
its fist down. And you can teach your brain to stretch out the resource. And it's like, subjectively, and you feel it happening. And then it
Yeah.
wears off a few hours later, and you talk to your coaches and say, well, I think I noticed some really interesting calmness. Great, try it again. And it builds up again. So the metaphor here for neurofeedback is personal training, but the real change starts even before you get change. Once you sort of conceptualize your suffering as physiology, not as
Yeah.
a label, not as things happening to you.
Sure.
You're a therapist or in a
Yes.
clinical role. You create transference. This is container, there's relationships, there's expertise, there's treatment. I'm a coach. I'm a PhD scientist. My
Right.
job is to educate you, teach you stuff, and thrust agency back upon you. Go forth and transform. Here's some tools. Come back and we'll celebrate and cheer you on and nag you to do more and whatever else. But it's a very different relationship when you're becoming your own expert. And that's sort of our different play into neurofeedback is the
Yeah, I mean, that's beautiful. It sounds like, in a way, from the metaphor would be a biomechanical approach where you're stretching muscles. if they're tight, and then they're adaptive, so they go back to being tight again. But the more you stretch over time, the more nimble and loose they become. So these systems, instead of being jammed up or looping over time, start to relax that pattern. Is that an accurate
I think so.
recap?
I think the
Okay.
metaphors sound, because most things we suffer from, anxiety, executive function stuff, sleep dysregulation, is actually closer to a resource that's spasmed or gotten stuck in a certain regulation
Yeah.
mode. It's not really a disease process. I mean,
Right.
there's a
That
lot of
makes
suffering involved with all kinds of psychological and physiological things, but an awful lot of the brain stuff is not really progressive disease things. It's an over adaptation or an
yeah.
accommodation to something. So
So I think you answered the question about what EEG does exactly, like how EEG is different from biofeedback.
yeah. Yeah. So biofeedback is an overarching term, and then EEG neurofeedback is one of the forms of it on the brain. But you could
Okay.
also do EMG on a tight muscle, or
Mm,
you could do heart rate variability on the vagus nerve, which controls the
right.
heart, beat to beat variability, which integrates the arousal, sympathetic versus parasympathetic balance.
Uh-huh.
So that's a form of biofeedback, which
Sure.
we do as well. Peak Brain is focused on integrating sort of programs for you towards your goals, because we're not diagnostic. It's all your goals.
Yeah.
So we might include HEG or HRV biofeedback, or EEG neurofeedback,
Mhm.
mindfulness education. We might teach them to use a sleep tracker. We might teach them to use an acetone meter to do macronutrient sort of functional neuroscience biohacking, where you learn to control like insulin resistance and sleep strategies to get better brain health. And then you see those things change on your brain maps later on,
That's
your
really
cue region.
extraordinary. So when you talk about biohacking and peak performance, what are you talking about there? And well, I guess in part what I hear you saying is that people have conditions that we consider pathological, meaning problematic, whether it's ADHD or OCD or high anxiety, and that this can help enormously with that. But what if somebody is pretty regulated and they have strong executive functions and
Yeah.
they feel fine? How does that tie to what you're calling peak performance?
Yeah. Well, first of all, people are weird. So
Yes, we
good
are.
job. Be weird.
Yeah.
So when I'm looking at your brain, like compared to like population averages, it's
Uh-huh.
not like, why aren't you average? Let's make you
Right.
average. It's more like, hey, here's a yardstick. Here's how you stack up against it. Here's a few things that jump out. And when it comes to executive function testing, we always do classic CPTs, which are very valid for executive function, go, no go style tests. Those are okay, straightforward compared to the average person your age. Here's where you're impulsive. Here's where you're inattentive. You've got some auditory versus visual. It's stamina issues, whatever. But the value there is unpacking the physiology, the performance below the level of the label. So it's not ADHD, it's impulsivity or an auditory processing issue or reaction time or something. But
Mhm.
then you end up with like a particular set of, oh, that's the bottleneck. Interesting. Oh, my teacher says I'm really, really ADHD and I can't sit still and I'm always moving. And look at the person's brain and their executive function is fine for the first 15 minutes of a test, but it burns right out in the last 5.
Right.
Stamina issue, not really classically ADHD. You look at their brain and you don't see ADHD, which is high theta. Instead, you
Right.
see lack of beta and draggy alpha waves. And the person's kind of anxious, and you kind of figure out they have sleep maintenance issues and they're generally anxious and they're have fatigue and stress kind of fighting each other all day long, and they're brittle and reactive, not squirrel, not hyperactive, but you can't always tell the difference in a 14-year-old who's stressed out.
Sure.
So the maps and the tools can sort of give you this, and not just like give you like a particular intervention of neurofeedback, but start to unpack, hey, wait a minute, here's what's going on. So if you see that your alpha speed is running slower for your age than the average person is, if you're above 30 or 35, you probably have word finding issues, delayed recall and tip of the tongue and hunting for stuff. But that's actually not aging related memory, which everyone thinks it is. Aging related memory stuff, which usually doesn't happen before age, late 60s, but aging related memory stuff, the first thing you lose is episodic memory or first person perspective experiences. You don't lose words and names and semantic information. If you have
Right.
Alzheimer's or Parkinsonian dementia or LBD or something, you lose the semantic and word information well after you're far gone. So don't worry about it. Word finding, delayed recall, you're reaching for loading stuff into your mind, into working memory, and you're having handoff mismatches, timing mismatches, you're grinding your gears. So I can usually predict if an adult is having word finding issues because the alpha speeds are all desynchronizing. And if a kid's having that, they run so fast that finding words is fine. They have trouble absorbing information from the outside world. So I'll say, oh, you're reading a book and discover 10 minutes in, your mind's been doing something else for 8 of those minutes. Wow, yeah. Because the intensity dips and the speed, there's nothing to synchronize the information flow anymore. So when you see these things, it's not like, oh, and now I'm doing neurofeedback. I mean, yes, you can often do that. And if there's suffering, if there's acute stuff, you got big goals, great. There's a hammer, we can hit some nails. But for other people, it's like, here's some agency. Oh, you just had COVID, and now I see Delta everywhere. Oh, that's really uncomfortable. Good strategies, try keto. There's a hyperbaric place down the street, really hack your sleep. Really watch those, oxidative stress things. Let's see how you look in a few months.
Right.
You can now track metrics the same way you might look at your lipid panel at the doctors and go, ooh, better back off in the Ben and Jerry's for a few months. Yeah, it's just agency. You just learn.
Yeah, well, that's
without,
beautiful. It sounds like it's really a holistic approach that you're looking at the whole person uniquely as they are because everybody's so different.
They are. People are weird. Lovely people are quite weird. Yeah.
How does mindfulness practice fit into this process? Because you mentioned that also, or how does it complement these processes?
Yeah. So mindfulness, of course, for folks who are familiar, it's getting all the rage. So I'm probably not telling
Yes,
anyone new, but I consider it. So the classic definition is, I think this is maybe John Kabat-Zinn said, paying attention in a particular way to the present time on purpose. The act of meditation or mindfulness writ large is actually one of executive function, which people often don't realize until they do a bunch of it. It's not an act of relaxation. You don't go to the gym and be strong. You go to the gym and be weak. And later on, you're strong. You go to meditate and you're distracted as heck. And your mind is wandering and your knee hurts and she's cute. And oh, my stomach's rumbling. That's what happens when you're meditating or doing mindfulness. And many forms of mindfulness are an anchor or an executive anchor. They take the prefrontal cortex and they help you direct executive function on single point of awareness, on present time flowing by, on a feeling tone. They're an active executive anchor. So executive systems are one of the big 3 things I tend to want to have a beautiful foundation for: sleep, stress, and attention being the executive, as things that scaffold all the other higher level human things. There's no mood thermostat in the brain, but there are measures for sleep quality and executive function maintenance and things like that. So train those and the whole system tends to resolve. So it's foundational and fundamental. It's also something you can do voluntarily. Most neurofeedback's involuntary. You get to choose what to work on and then say if it works as you iterate. You don't get to make it not work. You can't make it not work in the chair. Your brain gets moved.
Right.
And you go, ooh, I like how I feel, or ooh, I feel a little weird, and it wears off. You tell your coach. But it's involuntary exercise. So we want this voluntary piece of it. While the neurofeedback is like the coach in the gym, helping you build resources, the mindfulness becomes the coach in the field, helping you realize you're dropping your shoulder or something when you're trying to execute, and you learn to navigate and integrate the voluntary resources. And we make that a big piece of it. All of our clients get mindfulness training if they wish, or if we can talk them into it. And we have weekly groups as well that are both online and in person. Since we are working with your mind and your brain, I feel that that's the sort of minimal piece we should be doing for clients who might have others particular cognitive and deeper stuff they want to work on. Often when people come in with diagnostic language-based things, they've also got other team members, which is great. So I'm not going to work on schizophrenia without a psychiatrist on board or something. Sure. But when someone comes in who has a lot of desire to transform and change their brain, I feel that some guidance with that and some structure, some community can be very, very useful. So all the clients get some direct instruction, but then they get this weekly group. So, you can do that during neurofeedback, although I often recommend it, especially with anxiety. I remind folks later on, oh, you finished your program, you're feeling great. Oh, don't forget, you have these mindfulness private sessions available, and there's a weekly group. And oh, yeah. And then we create follow-on healthy habits and behavior in a sneaky way. And we also, our physical offices, we have 4 in the US and a couple popping up overseas now. Our physical offices are set up with a membership set up so that people pay one time and they have access throughout the year for brain mapping.
That's great.
So they often do this thing where they work on their ADHD or their post-COVID fog or their seizures,
Whatever.
their migraine or
Mhm.
their creativity or whatever, and get through it in a 3 to 6 month time frame and transform pretty deeply. And then we want to provide this longer amount of continued agency, continued habit hacking and doubling down on things so that fixing your sleep issue translates into better sexual performance a few months later when your cortisol drops, for
Right.
instance. Like these things are foundational. We don't want just to stop when you're done the problem you walked
Sure.
in for.
Yeah. So again, I keep hearing a holistic approach to brain health and well-being. And speaking of sexuality, because I am a clinical sexologist, I wanted to ask you about how these processes might help to optimize people's sexuality, or not their sexuality, but their sex and their sex lives specifically.
Inhabiting your own sexual identity, nature, expression, joy, pleasure is really complex across people. And honestly, while there are some things specifically we do that have sexual sort of targets with neurofeedback, I treat a lot of sexual complaints. So people come in sometimes with performance complaints,
Mhm.
sleep issues, or I mean, often a sexual problem when I'm hearing about it is an anxiety landscape, or it's a parasomnia or dysomnia. Someone has like
Mhm.
a middle of the night arousal phenomenon that wakes them up. That actually
Yeah.
happens to some men, where they can't fall asleep because an erection wakes them up, and they are like have it's almost like a tick essentially.
Yeah.
So I see those people. I see people for whom performance has become very stressful, and it's like any other flavor of anxiety. And I see folks. The other big thing I see is folks, women in their late 30s and 40s who are trying to do everything they can to get pregnant, and cortisol gets in the way of that. So someone's got dysregulated sleep and they're stressed, and they'll, their fertility doc will say, addressing your anxiety or sleep issue would do as much as the hormones we're doing. So you should probably, hey, biofeedback, and they find us that way. So I tend to see the sort of the sexual piece of it for folks in the larger goal landscape. And, for folks that are anxious, the goal tends to be about different flavors of anxiety or perseveration, or maybe social anxiety, or maybe trauma history,
Yeah.
and it's about detachment stuff now, not really about the sexual, it's about the attachment perhaps. And you can do
Mhm.
amygdala type, massaging essentially.
Right.
And then for other folks, you have these quirky, weird brain things like night arousal phenomena, or sometimes you get folks with post SSRI depersonalization and
Yeah.
anhedonia and low sexual tone
Mhm.
because of that. And not all these things are super tractable in the neurofeedback landscape,
Right.
but you can really get good impact on anxiety, sleep quality, and plasticity in the brain, which can do a fair amount for helping then, narrow the landscape of things you're trying to work on.
Sounds
Um,
like it. Yeah.
and then you can be a little more specific, and you can be a little more, targeted with trying other interventions as you need, working with that person on the post SSRI, working with the fertility doc on specific interventions, because you're no longer trying to, drive cortisol down because your deep sleep is suddenly regulated, or, whatever. So
Yeah. All right, great. Well, that's really interesting and useful to certainly those people who come to Center for Healthy Sex for treatment. So, Dr. Hill, where will people find you? I know you said you're in Culver City right now, but where else are your offices around the world, and how can people locate you wherever in the world they are?
yeah, so we're in West LA, of course, in Culver City. We're also in Southern California and down in Orange County in Costa Mesa. We also have big offices in St. Louis, and we have one in New York City, in Manhattan. We are right now opening up. We have a concierge technician in London, and we have somebody in
Ooh,
Stockholm. And there's a few other cities we're in, but actually 80% of our clients never see our offices,
I
and we
see.
send them equipment, and our
Mhm.
coaches do brain mapping virtually, and we give them amps, and we have live people 7 days a week to teach you to do neurofeedback on your brain and troubleshoot what you're doing, and hold your hand as you set up wires and curse Windows for having done an update just then, because it does that.
That's fantastic.
Right. So we are, again, a personal trainer type of phenomena. So we tend to support, we have these physical office network, and folks come and map their
Mhm.
brains and have fun with it. But you don't have to be near the offices to work with us. If you want to
That's
find
great.
us on the socials, we're at Peak Brain LA almost everywhere. but our website is peakbraininstitute.com. So come check us out and share your brain with us, and we'll be happy to show you all that stuff.
That's great. Well, it sounds like you're doing really cutting edge and exciting work. And so now everybody knows where to find you. So it's been my pleasure to talk to you today. And if anybody has any questions, please feel free to either write to us at centerforhealthysex.com, or you can find Dr. Hill at Peak Brain Institute. All right. Thank you.
Of course, my pleasure. Thanks, guys. Take care of those brains.